The spread of the Omicron variant is creating widespread concern. At least 17 states now have identified cases of the new variant. Georgia joined the growing list today, and a Norwegian cruise line ship carrying at least 10 passengers and crew infected with the COVID docked in New Orleans. Tonight, health officials are trying to figure out the best game plan against Omicron.
Some are working on getting an Omicron-specific vaccine, but as CBS 13's Tom Hansen reports, others say there's evidence that it might not be as bad as the Delta variety.
As the Norwegian breakaway arrived in New Orleans Sunday, Louisiana health officials said they were testing everyone on board for COVID-19. The cruise line was trying to prevent more spread after confirming an outbreak on the ship that made stops in Belize, Honduras, and Mexico. Meanwhile, as the new Omicron variant spreads nationwide, Georgia's health officials announced the state's first confirmed case. The person recently traveled from South Africa, where the strain was first detected.
The question right now is whether or not this is reinfecting people who have Delta immunity and haven't been vaccinated, or whether it's going to also infect people who've been vaccinated. There's some reason to believe the vaccines could be more protective than just immunity acquired through natural infection from Delta.
CDC Director Dr. Rochelle Walensky indicated the FDA is in talks to pave the way for an Omicron-specific vaccine.
Much of that I would have to defer to the FDA, but they're already in conversations about streamlining the authorization of this, of an Omicron-specific vaccine, partially because much of the vaccine is actually exactly the same, and really it would just be that mRNA code that would have to change.
So far, health officials have reported that the handful of known cases in the U.S. have been mild in vaccinated people, but they say there is still not enough evidence to know what to expect from Omicron.
Tonight, researchers think they may now know why Omicron is more infectious.
They say recent research suggests the variant may have picked up genetic material from the common cold.